Hi everyone, so in this video we are going to talk about obsessive compulsive disorder, or OCD. So obsessive compulsive disorder is a disorder in which a person's life is dominated by repetitive thoughts, called obsessions, and behaviors called compulsions. It's not the same as when people make jokes about having OCD. For example, oh, I'm so OCD, my desk has to be perfectly clean. It's not the same thing. So imagine, if you will, checking your door 30 times but still not being sure that it's actually locked. You know what your feelings are rational, but you still feel like you have to go and check it again and again and again. Imagine you also have to repeatedly check and make sure that the oven and the coffee pot are both off. Imagine getting a few blocks away from home and having to turn around and go check all of it again because you're still not sure that the door's really locked, that the oven's really off, or the coffee pot's actually off. That is what it's like having OCD. So now, what are obsessions and compulsions? Well, the obsessions are those repeated, intrusive, and uncontrollable thoughts or mental images that cause a person anxiety or distress. It's not the same as everyday worries. Normal worries have some sort of a basis in fact, but obsessions have little or no basis in reality and are often pretty far-fetched. A common theme is pathological doubt about having accomplished a single task. Another common obsession is an irrational fear of dirt, germs, or other form of contamination. Now, the compulsion, that's the repetitive behavior that the person feels driven to perform. Ritual behaviors have to be carried out in a certain pattern or sequence. It could be overt physical behaviors like repeatedly washing hands or checking doors and windows or entering and re-entering a doorway until the person walks through the exact middle. So it could also be covert mental behavior such as counting or reciting certain phrases to oneself. Some people will actually count things as they walk along, like in a store, count the number of items on the shelf. I had a patient when I worked in the eating disorder treatment clinic who would count her grapes and her carrots. And if she had an even number, she would not eat them. She would only eat them if she had an odd number of grapes or carrots. That was part of her OCD. It's important to know that if a person tries to resist the compulsion, they get unbearable tension and anxiety and distress. So now, obsessions and compulsions fall into a limited number of categories. About 3/4 of patients with OCD suffer from multiple obsessions. Slightly more than half report more than one type of compulsion. Most common obsessions and compulsions can actually be found on page 515 in your book in that table 13.3. So it's important to know that many people with OCD have the rational belief that a failure to perform the ritual in the exact way that they're supposed to will lead to something catastrophic or disastrous happening. Many people with OCD, especially those with checking or counting compulsions, are actually prone to superstitious thinking. Like this person believed with the carrots and the grapes, an even number was a bad thing. Something bad would happen to her if she ate an even number of carrots or grapes. She could only eat it if she were given an odd number. She actually thought that either she would die or her mother would die if she ate an even number of the fruits or vegetables. Even though the person knows that his or her obsessions are irrational or compulsions are absurd, he or she is still unable to resist the force. Most commonly, both obsessions and compulsions are present and are linked in some way, but it's possible that there's little logical relationship between the two. So for example, a woman who believes that if she does not get dressed in a certain way, her husband will die in an automobile accident, there is no link between clothing and automobile accidents. So it's important to note that obsessions and compulsions actually take a similar shape in different cultures. So the content of compulsions tends to mirror that particular culture's concerns or beliefs. In the US, compulsive washers are typically preoccupied with obsessions and obsessional fears about germs or infection. But if you go to places like Nigeria or India, compulsive washers are usually far more likely to have obsessional concerns about things like religious purity as opposed to germs. So if we look at trying to explain obsessive compulsive disorder, once something develops an anxious response, conditioning can reinforce it. So the unpleasant feeling of anxiety can be temporarily relieved by giving into that compulsion. So a person who is anxious, did I lock the door, can temporarily relieve that anxiety by checking to see if the door is locked. And although the relief is only short term, repeating that compulsive behavior will create reinforcement because they keep going back. Okay, I checked it and I felt better. But is it locked? I'll go check it and I'll feel better. But is it locked? I'll go check it and I'll feel better. And it keeps repeating itself. There's also biological factors. OCD has actually been linked with broad deficits in the ability to manage cognitive processes such as attention. And deficits in the neurotransmitters norepinephrine and serotonin have also been implicated in OCD. People with OCD can actually be treated with drugs that increase the availability of norepinephrine or serotonin in the brain, and so they will actually decrease their symptoms by the use of these medications. So that brings us to the end of the first section of Chapter 13. Thanks for watching.